So again, good morning. So this is the continuation of the part one of the scanning programs in protocol. Okay, so so during the first recorded video, we discussed all about the CT scan protocols for the head and the neck. Okay, so today for this video, I will be discussing all about the chest protocol and the abdominal protocol. Okay, so CT scan of the chest is the CT imaging. The organ of the chest presents unique challenges because of their continuous motion. Improvements in speed and spatial resolution that have been realized as a result of multi-detector CT or ginatawag natong MDCT has been particularly valuable in CT imaging or chest imaging. Post-processing techniques such as three-dimensional and multiplanar reformation can accurately display the pulmonary and coronary vasculatures. So these new non-invasive CT scan imaging techniques can augment and sometimes replace most invasive methods such as coronary angiography. Okay, so again, the primary challenge kung mag-scan ta og CT scan of the chest is the continuous motion because sa ato ang thorax, we have the lungs nga naay continuous movement sa iyahang breathing and abot tay heart nga continuously pump kay mga involuntary motion. So it is crucial to the part of the CT technologists to eliminate or to reduce this so-called motion artifact. Most thoracic protocols are performed while the patient lies in supine position on the scan table with the arms elevated above the head. In a few instances, primarily high resolution protocols of the chest and additional scans are obtained with the patient in prone position, but it is very seldom mag-prone position ang pasyente. So using the shortest scan time as possible will help to reduce artifact created by cardiac motion. Even or whenever possible, scans of the chest should be acquired within a single breath hold, as this will prevent misregistration caused by uneven patient breathing between scans. Okay? So, in order to reduce this so-called motion artifact, kinahanglan natay mga intervention like shortening the scanning time or instruct the patient for a single breath hold kung makaya niya. Okay? Hantod asa niyang kaya. Okay? The thorax has a high intrinsic natural contrast of any body part. The pulmonary vessels and ribs have significantly different densities from the adjacent aerated lungs. In most adults, the mediastinal vessels and lymph nodes are surrounded by enough fat to be easily identified. So some of the tissues or the parenchyma or the surrounding tissues within the thorax is na siya ginatawag na natural contrast. So in other words, because na siya highly or high intrinsic natural contrast, for these examinations of the chest, pwede na ta dili magamit og contrast. But for other pathology condition nga the contrast is highly indicated, kinahanglan na to magamit jud og contrast media, especially the non-ionic IV contrast. Okay? Okay, so for example, scan done for the screening or detection or exclusion of pulmonary nodes or infiltrates like kanang pneumonia, kanang TB, roll out kanang ingana nga mga sakit. Typically, wala nang nagagamit og contrast media. But for demarcation of the esophagus, kanang mga pathology condition of the esophagus and the trachea, kinahanglan nato maggamit o ginatawag natong oral agent, most often ang barium suspension shortly before the beginning of the scan in order to visualize the so-called demarcations. For the CT scan of the chest, the patient preparation is fasting for 3 hours before the examination. A chest X-ray is highly uh, kining ginatawag na to nga kanang preferred nga naay chest x-ray ang pasyente for two views, the AP projection and the lateral projection. Positioning of the patient is in supine and arms folded behind the head. So, dapat nakaingani ang pasyente. Okay? Nakasupine din, nakaingani ang kamot. So, starting at the lungs apex and aspiration is suspended, mo na yung mga parameters niya. So, dapat pag magkuha ta, kung natin grid application, dapat ang field of view is dapat from the apex of the lungs going to the diaphragm. Okay, dapat makuha dyan ang entire lungs. Okay, kung pwede, masubra pa siya dito sa neck, sa superior aspect, and then dito sa the extend na to gamay mga 1 inch or sa datong diaphragm or mga mga ingana kalayo para dako ang ato ang range ato ang scan. Okay? So units controls the scanogram is in AP projection. Okay? Gantry tilt is 0. Okay? Mao na typical nga gantry tilt, wala siya gantry tilt actually. Slice thickness is 7 millimeters. Soft tissue or mediastinal window and long window is recommended for our window width and window level settings. Okay, so this is the image of the mediastinal window. So as you can see, ang katong makita na to is kaning sa cardiac or sa atong heart, makitaan kayo siya, highly visualize ang mga pulmonary vasculatures. But sa lung window, kitaan jud ang mga tiny details like this, the terminal pulmonary vasculatures and kani mga infiltrates, maklaro nimo siya sa lung window. Okay? So that's the advantage of this windowing settings. So for pathologic findings, reduce the slice thickness, okay? Para mas makita nato itong mga smallest detail ug mutaas ang iyang spatial resolution. Interstitial diseases use the high resolution technique with a slice thickness of at least 2 mm slice in lung window. High resolution of lungs parenchyma needed or no IV contrast is needed. Okay, so dito magamit ang contrast media kung parenchyma lang atong mga gina-roll out. Like for example, mga bone tissue and other parenchymal areas or parenchymal organs of the lungs. So, for the CT scan of the abdomen, certain factors or condition may interfere with the accuracy of CT scan of the abdomen. So, this includes metallic object within the abdomen, such as surgical clips. So these surgical clips will interfere because it produces a star pattern artifact. So, mura siya star pattern kung makuha sa image, okay, or sa CT scan image. Barium in the intestines from the recent barium study. Kung ang pasyente nag-undergo siya og contrast study or barium study sa conventional radiography and then mag-undergo na po siya CT scan tapos napay barium retention, naay tendency nga katong barium na to mag-star pattern po siya similar sa katong surgical clips. And because barium suspension na ginagamit sa conventional radiography and CT scan is very different in terms of its content. So, dili sila compatible. So, dili mo pwede gamitin tong barium contrast sa conventional radiography sa CT scan. Okay? Stool or fecal materials or gas in the bowel is very or may interfere the accuracy of CT scan of the abdomen. It's because pwede mo camouflage diya katong mga pathologic disorder sa tuang tiyan. Okay, so the CT scan technologies must instruct the patient to do a fasting and cleansing the bowel. Okay, so CT evaluation of the abdomen and pelvis requires greater attention to the patient preparation. Then, the CT evaluation of any other areas of the body. Most CT scan of the abdomen requires administration of oral contrast agent to demonstrate the intestinal lumen and the descent of the gastrointestinal tract. The use of oral contrast material is imperative to differentiate the fluid-filled loop of the bowel from a gas or from a mass or an abnormal fluid collection. So it is kung mag-rule out taog ka ng mga pathologic condition of the intestinal tract, we oftenly use this oral contrast agents, so ginatawag nato nga barium suspension. But kung wala may barium suspension, we can use water as our negative contrast media to delineate the so-called mga pathologic condition. Okay? Either a dilute barium suspension or a dilute water-soluble agent may be used with equal effectiveness. Okay? Pwede ta magamit og dilute barium suspension or kaning water-soluble or kaning iodinated contrast media. Kay pareha na sila effect. But the problem is, pag water-soluble atong gamiton, it is highly absorbable sa atong intestine. So, dali lang siya ma-absorb. Okay? But again, it is used to evaluate kaning mga ruptures, okay, mga perforations sa atong intestine, mga buslot ba. Okay? Okay, na mga samad, pwede na ito gamitan ng water soluble. In general, the greater the volume of the oral contrast material, the better the bowel of acidification. Although a volume of at least 600 ml is desired, patient compliance may be a limiting factor. Okay? So, ang pinaka-desired nga volume sa ato ang oral suspension is 600 ml. But depende na sa pasyente. Kaya yung bang pasyente, kulang pa ang 600 ml or restricted sila from taking too many fluid intake sa ilang body. Okay? Patients should be given only clear liquids for at least 2 hours before the scanning to ensure that food in the stomach is not mistaken for pathologic tissues. So for the preparation of the patient should fast. Okay? So dapat mag-fast yung pasyente for 4 to 6 hours before the examination. The radiologists sometimes need abdominal ultrasound for comparison. Okay? Oral laxative must be given like castor oil or phosphosoda para mas malimpyuhan pa ang ato ang intestine. IV buscopan is required at the time of the examination. Kung walay IV, pwede ra po siyang oral. Okay? So many metallic foreign or any metallic foreign object must be removed, like for example kanang mga jewelries, mga amulets, mga anting-anting. At the same time kanang strap sa bra kinahanglan tanggalon. Preferably the patient should be in hospital gown. So pasuton nato siya gown. So contrast media to be used for abdominal CT scan is oral contrast and IV contrast. Okay? Again, different protocol sa hospital, mag-vary po siya. Okay? So, maybe this protocol nga ako i-mention is not applicable for any institution, okay? And applicable sa other institution. Okay? It depends sa protocol sa institution. So, for oral contrast, at midnight before the day of the examination, 800 ml of contrast media with at least 5% of gastrophin and 95% of water is administered. Patient asked to drink 700 ml during these hours and the last 100 ml immediately before the examination. Replaced now by oral water in mannitol or mannitol. So for IV contrast, 100 ml of non-ionic contrast media is preferred to be used like Omnipaque or Ultravis, pwede na to siya gamiton nga contrast agent. Okay? Pag non-ionic man gud, non-reactive man gud just for allergic reaction. So mao na ginagamit. Note that air and water are excellent as low attenuation contrast agent. So kung wala may oral suspension, pwede mo maggamit ng water because it is a low attenuation contrast agent. Especially, pwede po air using carbon dioxide. Again, air and water is excellent as low attenuation contrast agent. So for air or carbon dioxide is frequently used to insufflate the colon for CT colonography, producing a very high negative contrast media. Water also has a low HU. Oral barium sulfate suspension is sometimes used in place of positive contrast media. So kung wala mo'y Barium suspension nga positive contrast media pwede kaning water soluble ay water, okay, or tubig lang because it has a low attenuation Hounsfield unit. This low attenuation HU agent will not obscure mucosal surfaces or superimpose abdominal vessels on the post-processed image. So the use of low HU oral contrast has added advantage in that it does not mark radiopaque stone in common bile duct or urinary tract. So dili siya mag superimpose dito sa katong mga stone sa gallbladder or sa urinary tract is because low attenuation HU man siya. Kaya always remember na ang stones is radiopaque. Okay? Very radiopaque siya. Kanang hayag kay siya or puti kay ang appearance. So kung nagamit ang positive contrast media, na tendency nga mag-superimpose ang kaning mga stone dito sa contrast media. Few institutions routinely administer rectal contrast material. When it is used, the most common indication is the colon cancer staging. Bladder is best appreciated on CT when it is filled with urine or contrast agent. So some institution uses or administer contrast agent or barium suspension rectal. Okay, administer in a rectal area. Isulod siya sa lubot. Okay, para ma-visualize ang colon. Okay, sometimes bladder, tubig na pod, or urine. Pag napuno nag-urine, highly visualized na ka ng mga stones or remnant stones and other pathologic conditions sa urinary bladder. The vagina is seen in cross-section as a flattened ellipse of soft tissue between the bladder and rectum. So, dili kayo makita ng vagina kay mura siya naipit sa bladder o sa rectum. So, ang ginahimo ana, it is inserted a tampon will outline the cavity of the vagina with air density and is useful for identification of the vaginal canal. But sometimes, ang among ginahimo is mag-introduce or magkuha mi og kanang syringe and i-fill na mo to with positive contrast agent. Then butang namo sa condom, isulod namo sa vagina para mahimo siyang marker namo na mauna na siyang vaginal canal. Okay, para ma-delineate namo siya from the rectum and the bladder. So this is the position of the patient in abdominal scan. So pwede siya head first, pwede po siya feet first. Okay? But we prefer nga naka-feet first ang pasyente. Okay? Para mas dali ba? Okay? Mas duol. So this is the scanogram. Naka-AP projection siya with the grid lines. So kung pwede, dili siya maputol sa diaphragm and makuha po pati ang pelvic area. Okay? So this is the mediastinal window of the abdomen. Okay, this is the soft tissue window of the abdomen. So, as you can see, makita niyo ang mga pulmonary veins and hepatic artery. Okay, pulmonary veins, portal veins pala, and the hepatic artery sa imong liver, okay, nga filled with contrast, and then the stomach also filled with contrast media. Okay, another image of the pelvic area of the abdomen. As you can see, makita nato diya ang colon nato nga naay contrast media or positive contrast agent. So, non-contrast CT of the abdomen includes urinary tract evaluation, especially kaning stone protocol o stonogram. So, wala ta nagagamit og contrast media ani kay highly opaque naman ang stones kung mag-study ta about urinary tract. Emergency CT of the appendicitis, pwede na non-contrast, and abdominal trauma kung mag-roll out ka ng GI bleeding or intestinal bleeding or ka ng rupture, okay, sa tuwang intestine. So this is an example of an image of a coronal view, okay, coronal plane of a non-contrast study. Specifically, this is a stonogram. So as you can see sa right kidney niya na ay murag radiopaque nga bilog, di ba? That is a stone, okay, sa iyang renal pelvis. Okay, so dili na kinahanglan og contrast media because klaro na kay siya sa plain CT scan. So for the CT scan of the lumbar spine, preparation is usually wala na siya preparation, okay? Contrast media is wala na po siya ginagamit. Okay, kung sa lumbar. But again, kung mag-rule out tawag ka ng mga masses, pwede na to siya i-gamiton ng contrast media. So, the orientation for the lumbar scanning is naka-fit first siya, hindi naka-supine. Okay, ang iyang kamot is naka-rest, naka-ana. Okay. Position, supine and feet first, arms above the head, and the knees are flexed in 30 degrees. Okay? So, para ma-flex dyan niya o walay motion, nagabutang mi og ka ng angled nga nga wedge sa iyahang knee para ma-angle niya yung feet into 30 degrees. Parameters, the scan should start or the scanogram should start at the xiphoid process going to the pelvic joint. Okay, ending at the level of the hip joint. Respiration is suspended in expiration or pagkahuman o ginhawa. Then, dito pa ka mag-shoot. Okay? Unit controls. So, usually, 0 ang ato ang tilting. Lateral ang ato ang scout view or ato ang scanogram. So, sometimes, magamit og tilt. It depends on the disc spaces. So, especially there is L4 to L5, kay mo medyo nag-tilt man ang imuhang disc spaces or intervertebral disc space. So, kinahanglan na to magamit og angle. But again, kung maulang na ang imong gina-roll out nga area. But kung i-roll out nimo ang entire lumbar spine, 0 na lang ato ang tilting range. The slice thickness is 3 millimeters. So this is the bone window. Kung mag-roll out ang fracture of the lumbar spine or compression fracture, kinahanglan natay bone window. As you can see sa image, na ay fracture sa left transverse process sa ato ang lumbar spine. Okay? This is the soft tissue kung mag-roll out ka ng abnormal mass, okay? Especially sa atong spinal cord o sa atong mga nerves. Okay? So this is the entire CT scan protocol. Okay, so we have CT scan protocols. Wala na to na appeal because it is not routinely perform. Okay, let's say for example ang kanang inner ear. Okay, kanang mga knee examination, fit kana is not seldom na siya ginagamit labi ng pelvic bone nga examination. But kani siya usually mo ni mga routine nga CT scan examination. The CT scan of the head sa katong part 1 nato nga discussion, the neck, okay? Mo na siya gina-scan. Okay? Sa kaninga chapter or kaninga part is the kanang chest, the abdomen, and the lumbar spine. Ano yung mga routine usually mo na gina-perform na mo sa CT scan. So that's it. So again, katong sa part 1 is ang camera is nag-superimpose dito sa katong text. So kindly ano na lang provide a copy sa katong PowerPoint na akong gi-attach para makita ninyo. Okay? Again, if any question will arise or na may mga bugling questions sa inyong una-una, pwede ko ninyo i-message sa atong group chat. Okay? So that's it. So bye for now.